Hi, my name is Paul Strong. I'm one of the battalion chiefs here at the Valley Regional Fire Authority. We would like to show you some of the things that we're doing to help reduce the spread of COVID-19 here in our community. Also, to provide the best patient care possible to you, our citizens, and maintain the health and the well-being of our firefighters. As you may know, we normally provide patient care under the guidelines of King County EMS, and with the current COVID situation, we here at Valley Regional have taken an additional step by placing another aid car in service. The primary mission of this unit is to minimize the exposure our response personnel would have to COVID-19, thus maintaining a healthy workforce that can continue to respond to your 911 calls. This aid car is staffed 24 hours a day with firefighters who are living and responding at a temporary housing that is centrally located in our service area. During their assignment on this aid car, these firefighters are isolated from the remaining workforce in order to reduce the possibility of cross-contamination. They've also implemented additional procedures to ensure that everything, including themselves, are fully disinfected in preparation for the next response. Firefighter Erickson is now going to show you some of these additional steps we take to help in the fight against the COVID-19 virus.
Firefighters across the country have had to think outside the box and figure out ways to deliver the same excellent service to our patients while also keeping in mind how to protect ourselves and reduce any possible spread of the virus. And one of the ways we have done that is by modifying our patient compartment in our aid car. Now, it looks a little rudimentary, but this vapor barrier that we put in is really great for keeping any kind of airborne particulates inside this compartment and isolating the patient in here. We've reduced the additional seating so that there's only one firefighter that can stay in here, and therefore reducing the exposure of the entire unit. And he will be in full PPE, and then the patient will sit here. These barriers are very easy to clean. We clean it using a pretty genius little device that one of our firefighters adapted. It's a standard household paint sprayer that we fill with a blend of alcohol that when sprayed turns into a mist that gets in all kinds of cracks and crevices. It helps decontaminate this compartment after every transport and several times throughout the day. Some other changes to our equipment. This is our standard, what we call a vent bag or a aid bag. This is our new equipment container. It's what we call a scout box. Inside it is all the essentials we really need to do a quick assessment on patients. We still bring this entire bag because we will often need the equipment that's in there, but we leave it outside the residence. This is an attempt to try and reduce any surfaces that might get in contact with particulates. This box is easy to clean, and by having less things that you need to decontaminate after a call, it makes our turnaround time that much faster. What I'd like to talk about now is our personal protective equipment that we'll be wearing when we're on COVID-related calls. There's a higher level of PPE that we normally wear, but it's important to help protect ourselves from additional exposure. I'm going to talk about each piece of equipment now, because the first thing that I'm going to put on is my mask, which makes it somewhat difficult for me to hear, and that's why I wanted to talk about. Communication can become difficult with patients with this mask on. The P100 is a mask that's designed to keep any and all particulates from getting into our respiratory system through our mouths and our noses, but then makes it a little bit hard for our voices to get out. So if we're leaning in a little bit closer to help communicate or talking loudly, the reason is because the mask really muffles our voice, and you'll see in a second. The next thing I'm going to be putting on is goggles, which are designed to try and reduce any kind of particulates getting into my eyes. They have a seal that goes around the entire forehead and around the nose. I'll be then putting on a gown and then 2 pairs of gloves. The reason we wear 2 pairs of gloves is not only for the additional protection, but it also allows us to shed one, and we still have a protective layer underneath that we can then add gloves or continue doffing the rest of our equipment. And then finally, we'll have a face shield in front of that.
Here at the Valley Regional Fire Authority, our vision is to create the safest community to live, work, and visit. Please be safe and stay healthy, and never hesitate to call us for help.